I am Dr. Vijay Kumar Reddy. Today I am going to discuss about the IVC filter retrieval. Usually IVC filters are put in patients with DVT to prevent pulmonary thromboembolism who are contraindications for anticoagulants. Here in this patient, who is a 30-year-old woman who got a fractured neck of femur and she developed DVT and there is a thrombus in the common iliac vein on the right side. So we decided to put IVC filter, which is retrievable filter. Usually the trend is to put a retrievable filters. Once the necessity is over for anticoagulation, then we have to retrieve the IVC filter. Then we can start anticoagulants. Usually we'll use platinum select Cook filter, which is the most widely used IVC filter. We'll put through the femoral vein. We put the IVC filter 2 weeks back. Patient's acute condition is stable. Now we want to retrieve. How to retrieve? For that we have to go through jugular route. First we will give a puncture with a micro needle. Afterwards we will puncture the jugular vein. Then we will pass a wire, long wire, and with that we will dilate sequentially with 6 and 8, 10 dilators. Usually we will use 11 French sheaths for the retrieval of IVC filter. There are so many techniques to retrieve the IVC filter, and the most commonly used technique is snare loop technique. This is the most commonly used technique. Here we pass the 11 French sheath, and over that we will pass a snare. We will snare the hook of the IVC filter, and afterwards we will push the sheath to encroach the IVC filter. Then the filter is removed entirely with the sheath. This is the technique of IVC filter retrieval. Usually we will use Gunther Tulips IVC filter retrieval filter, which is manufactured by Cook company. It is a safe technique. Now I will show some of the salient steps. This is the IVC filter with the hook. We pass the wire through the 11 French sheath. This is the hook of the IVC filter. Then this is the 11 French sheath. This is the loop snare. We are trying to catch hold of the hook of the IVC filter. Now we catch hold of the hook of the IVC filter. Now it is firmly stuck. Then we are advancing the sheath over the IVC filter, and this entire system is removed through the 11 French sheath. This is the IVC filter. That is the procedure, and procedure is done under local anesthesia. Thank you. I am showing how the IVC filter is removed through a special device. Usually IVC filters are deployed whenever there is contraindications for anticoagulants. In this lady we have deployed IVC filter Cook Platinum Select 2 weeks back because she has got contraindications for anticoagulants. After 2 weeks we are planned. For that we punctured the right jugular vein and put a sheath. Afterwards we put a 11 French sheath. Over the sheath we have passed the filter retrieval. We advance the snare and catch the hook of the IVC filter. Afterwards slowly withdraw the filter into the sheath and slowly withdraw the entire IVC filter. This is the technique of. Here the sheath size is 11 French. Thank you.
Sunshine.